Today we will discuss about therapeutic status of a drug. Now, why I have chosen this topic? Because if you will go through the standard textbooks of pharmacology, it is not clearly mentioned many a times regarding this point. And the second thing, it is again a commonly asked question in the theory examination as well as sometimes in the viva also, that what is the therapeutic status of a particular drug in a given condition. So before discussing about that, some background information, that you all know that a particular drug, say for example a corticosteroid prednisolone, it is used in various clinical conditions, and at the same time a particular clinical condition, say for example a bronchial asthma, in which there can be many drugs which are useful. So now, if a therapeutic status of a drug has been asked in a particular condition, then what you should exactly write or you should speak, that we will discuss in this topic. Okay. So, first and foremost, that whenever such question has been asked, you have to understand that what includes in the therapeutic status. Unfortunately, the students are writing everything about that drug, but that is not required at all, and it creates bad impression also. So the first question that you should ask to yourself is whether the drug is really indicated in that condition. Now, to answer this question, you have to just think that whether any of the pharmacological action of the drug is helpful to treat or manage that clinical condition, then the answer can be either yes or no. If the answer is no, then there is a no further question of discussion. But in the examination, okay, generally no one will ask like this. In the condition where your answer is no, that this drug is having no therapeutic utility in that condition, so we have to focus on the first possibility, that the answer is yes. Now, if the drug is indicated in a particular condition, there are again two questions, that whether the drug is having a primary role or the main role, or the drug is having an adjunctive role or the supportive role or transient role for the management of that condition. Now, what is the meaning of that? Again, we will discuss this by a example. Now, you just take a very common condition, that is a P. vivax malaria, chloroquine sensitive P. vivax malaria. Okay, as the chloroquine is sensitive, the main role is of chloroquine. It is very obvious. Okay, but additionally, the patient is having fever also. So in the initial days, we are prescribing tablet paracetamol 650 milligram 3 times a day. So in this condition, the paracetamol is having adjunctive role. Now, this is one aspect, but there can be various other aspects also. Let me take another example, that is a bronchial asthma. Now, it is a clinical condition where you all know that bronchial asthma is a chronic inflammatory disorder of the airways. Now, there are various stages of the disease. One stage is that the patient comes with an acute attack of bronchial asthma. So your aim is for the termination of the acute attack. Now the another is the chronic bronchial asthma. Your aim is to control these or to prevent the progression of the bronchial asthma. Progression means the progression of the pathogenesis, because you know that it is a progressive inflammatory disorder. So the requirement of the drug is different. Look, seasonal asthma. Okay. So in bronchial asthma, even though there are n number of the drugs are available, there is a one drug which is required for the termination of the acute attack. There is an another drug or the combination of the drugs which are required for the management of the chronic persistent asthma. There is an another drug which is required for the prevention of the seasonal asthma, and there is an another, I will say, the armamentarium of the drug which are required for the acute severe asthma or status asthmaticus. So the given drug fits in which of these criteria, that again come into the therapeutic status of a drug. Now, suppose the drug is having, now we look the third aspect. Okay, first aspect what we have seen, whether the drug is having a primary role or adjunctive role. Second, even if the drug is having primary role, at the which stage of the disease, whether it is used for the termination of the acute headache, or it is used for the chronic management, or it is used for the prevention. Now the third is, suppose the drug is used for the chronic stage. I will give you the another example, that you all know that in the open angle glaucoma the intraocular pressure is raised, and patient has to take the intraocular medications, topical eye drops, for a, uh, a lifelong. Okay, but even if you are having various agents available, okay, which is a first choice drug, which is a second choice drug, and which is the last resort. Okay, like in open angle glaucoma, we are having the prostaglandin analogs, we are having the beta blockers, we are having the cholinomimetic alkaloids that are pilocarpine, and many more. But as far if we look at the efficacy, safety, and all other aspects, the preferred agent will be now the prostaglandin analogs. The only drawback with the prostaglandin analogs is it cost, followed by the beta blockers, and even though the first drug group that is found to be effective in the open angle glaucoma, that is cholinomimetic alkaloid, that is pilocarpine, but now it is the last resort of drug because of its pharmacokinetic disadvantages, adverse effects, and many more, and availability of the better drug. So in nutshell, if you want to categorize the drug as far as the choice of the drug is concerned, then which factors you should consider? One is the efficacy of the drug. Second is the pharmacokinetic advantages of the drug. Then the safety profile of the drug. Then the drug interaction profile, and lastly the cost. Okay, this will help you in deciding the whether the drug is a first choice or second choice or third choice. Now, in the last part, what you have to write, what is the summary, that whether the drug is effective or whether the drug is indicated or not. If yes, then the drug is having a primary role or the adjunctive role. Suppose the drug is having a primary role, then whether the drug is a first choice or second choice or the third choice. Okay, now in that, as I told you in the previous slide, you have to see is the comparison of the pharmacodynamic, pharmacokinetic, and the safety profile of one drug over another drug. And by comparing these adverse effects, then drug interaction, and yes, lastly, this is again a very important point, the cost. Okay, and as I have told you in the example of prostaglandin analogs, cost is the only limiting factor. Otherwise, the prostaglandin analogs are far ahead than beta blocker in case of the management of open angle glaucoma. Now, in that condition, you have to uh, provide a cafeteria approach to the patient. You have to explain the patients that this is a better drug, this is more effective, but it will cost around this. Then this is another drug which is nearly equally effective, but not as effective as that of the previous drug, but it is cheaper. And then you have to allow the patient to decide. Okay, so that's all about the therapeutic status of the drug.